Picture this scenario for a second. You're driving home from work, you're listening to the radio, completely relaxed.
Just minding your own business.
Right, exactly. You come to a stop at a red light, and out of nowhere, bam! The driver behind you was probably scrolling on their phone, and they rear-end your car.
Oh, yeah. We've all been there, or at least know someone who has.
Yeah. And it's a relatively minor crash, just a fender bender. You get out, you exchange insurance info, you drive home, and honestly, you think you're totally fine.
The adrenaline is still pumping.
Exactly. It masks everything. But then you wake up the next morning and it feels like someone poured quick-drying cement into your cervical spine.
Oh, that is the perfect way to describe it. Wet cement.
You try to turn your head to look at your alarm clock, and a sharp, shooting pain just stops you dead in your tracks. If you have ever experienced that exact sequence of events, you are far from alone. There is an official medical term for this, whiplash-associated disorder, or AWDO.
Right. And to understand why it hurts so intensely the next day, we have to look at the actual physical mechanics of what happens during that accident.
But whiplash itself.
Exactly. Whiplash-associated disorder is caused by a rapid hyperextension followed by hyperflexion of your head. When that sudden acceleration and deceleration happens during the impact, your head is essentially whipped back and forth like the tip of a cracked whip.
Hence the name.
Right. And the sheer sudden force of that movement brutally overstretches the muscles, the ligaments, and sometimes even the nerves in your cervical spine. And the statistics on how often this happens are, they're actually staggering.
How common are we talking?
According to the research in our sources today, specifically a study by Kim and colleagues, roughly 57% of patients involved in traffic accidents present with neck and back pain.
Wait, over half? That is a massive number of people waking up with cement necks.
It really is. But it's not just about the localized physical stiffness. Whiplash can trigger a whole cascade of systemic symptoms.
Like what?
We're talking about severe dizziness, tension headaches, major sleep disturbances.
Because you can't get comfortable.
Exactly. And even significant psychological distress and depression. Chronic pain is incredibly wearing on the mind. It is a massive, highly common public health issue globally.
And because it is so common, you'd logically assume that modern medicine has a perfectly unified, universally agreed-upon playbook for how to treat it.
You would think so.
But here's the bizarre medical contradiction that we are looking at today. All over the world, patients use acupuncture to treat their whiplash. It is a hugely popular conservative therapy, and people swear by it.
They absolutely do.
But if you look at major official clinical practice guidelines, like the ones published for Canadian and Australian doctors, they do not recommend acupuncture at all. In fact, one of the guidelines explicitly refuses to conclude that it is effective in any capacity.
It's a fascinating disconnect. You have what patients are actively seeking out in the real world on one hand, and what official policy dictates on the other.
Right.
But we need to clarify exactly why those clinical guidelines don't recommend it. It's not necessarily because the guideline authors had definitive proof that acupuncture is a sham.
It's not that they proved it didn't work.
Exactly. Rather, historically, there just wasn't enough high-quality, synthesized data available at the exact time those guidelines were being written.
Because medical boards don't just take people's word for it. They need hard data.
They demand rigorous, peer-reviewed evidence. They need systematic reviews and meta-analyses. Those are the massive studies that take all the isolated, sometimes messy human trials from around the world and crunch them together to deliver a definitive, mathematically sound verdict.
And that verdict was missing.
Up until very recently, that definitive verdict for acupuncture treating whiplash just didn't exist in a complete, highly scrutinized form.
Which brings us to the mission of today's deep dive. We are jumping into a brand new, highly anticipated 2024 systematic review and meta-analysis published in the medical journal BMJ Open.
A huge deal for this field.
Right. The research was led by Sang-Han Lee and an entire team from Pusan National University in Korea. What they did was update a previous older review from 2014, adding in all the clinical studies published since then. The goal was to figure out, once and for all, if acupuncture actually works for symptom alleviation in patients with whiplash compared to standard medical care.
And the scope of this new research is really impressive. The researchers cast a massive net. They scoured major global medical databases, PubMed, Embase, the Cochrane Library, pulling literally everything published right up to October 1st, 2023.
So very recent data.
Extremely recent. They started with 877 different articles. But because they were hunting for the absolute gold standard of medical evidence, they meticulously filtered them down.
Getting rid of the junk.
Right. They threw out animal studies, they tossed out single patient case reports, and they removed trials that didn't have valid control groups. After all that rigorous filtering, they were left with 8 high-quality randomized controlled trials involving exactly 525 patients diagnosed with whiplash-associated disorder.
Okay, let's unpack this. 525 patients, 8 rigorous trials. We have our data pool. So let's ask the ultimate question that every single person with a stiff neck wants to know. Does sticking needles in your neck actually reduce the pain?
The short answer from the data is yes, it absolutely does. The researchers synthesized the data from the trials that recorded pain scores. Usually these studies use something called a visual analog scale, or VAS.
Just to clarify for the listener, the visual analog scale, is that just the classic 1 to 10 pain scale you see in the doctor's office with the smiley and frowning faces?
That is exactly what it is. It's a simple, universally understood way to measure subjective pain. And when they ran the numbers across all these patients, the meta-analysis revealed a clinically significant reduction in pain for the individuals who received acupuncture compared to those who didn't.
Oh, okay, what were the numbers?
To put a statistical number on it, the standard mean difference was negative 0.57.
But what does negative 0.57 actually mean for someone sitting in their car right now? If I am at an 8 on the pain scale, is that going to drop me down to a 0?
Not to a 0, no. In the world of statistics, an effect size of negative 0.57 is considered a moderate effect.
Okay.
So in real-world terms, if you wake up with blinding whiplash pain at an 8 out of 10, this treatment isn't a magical eraser that makes it a 0. But it might reliably drop you down to a manageable 5 or a 6.
It takes the sharp edge off.
Exactly. It takes the debilitating edge off. And importantly, the researchers use something called the grade method to evaluate the quality of this specific outcome.
What is the grade method? It sounds like an academic report card.
It essentially is a report card for science. It stands for grading of recommendations, assessment, development, and evaluations. It's a highly stringent framework that tells us how much we can actually trust a scientific finding.
And how did it grade out?
They graded this finding on pain reduction as having moderate certainty. That means we can be reasonably confident that the true effect is close to what the math is telling us.
I'm curious about the actual physical mechanism, though. For a long time, critics have argued that acupuncture is just a placebo effect, that people feel less pain simply because they believe they're being treated. Does the source material give any indication of how it physically stops the pain?
Yes, the researchers do touch on the neurological mechanisms, which is fascinating. It's not just a placebo. The physical act of inserting the needles actually triggers a physiological response in the brain's reward and motivation circuits.
What kind of response?
Specifically, it stimulates the release of endogenous opioids, which are the body's natural painkillers, along with a chemical called 5-hydroxytryptamine.
5-hydroxytryptamine. Wait, isn't that just the fancy chemical name for serotonin?
It is. It triggers a release of serotonin.
Hmm.
So you are fundamentally chemically altering the way the brain and the body process the pain signals originating from that traumatized neck tissue.
Here's where it gets really interesting. Because as anyone who has had whiplash knows, pain is only half the battle. The other half is that you physically feel like Frankenstein's monster. You literally cannot turn your head to check your blind spot when you merge on the highway.
The stiffness is brutal.
Right. So, beyond just the pain scale, what about range of motion? Does acupuncture actually help you physically move your head again?
The data on range of motion is surprisingly specific, and this is where looking closely at the details really matters. The researchers broke down the different directions you can move your neck.
Okay.
There's flexion, which is looking down at your shoes.
Yeah.
Extension, which is tilting your head backward to look at the ceiling. And lateral rotation, which is looking side to side.
So up, down, and side to side.
Exactly. When they ran the meta-analysis, they found that acupuncture was mathematically proven to be effective for range of motion in extension, meaning it significantly helped patients tilt their heads backward.
Okay. And the other directions?
However, for looking down and looking side to side, the general results across all the combined studies were not statistically significant.
That feels incredibly specific to the point of being a little weird. Why in the world would a treatment only help you look up and back, but do absolutely nothing for looking down or side to side?
What's fascinating here is the anatomical explanation the researchers provide. It comes down to exactly where the needles are traditionally placed for this specific injury.
Oh, interesting.
The acupoints that practitioners most frequently use to treat whiplash have names like GB20, GB21, and SI11. If you map those points out on the human body, they are located right on the posterior muscles of the cervical and upper thoracic spine.
Meaning the muscles running straight down the back of your neck and across the tops of your shoulders.
Exactly. And biologically, those specific posterior muscles are the primary engines that control and facilitate cervical extension, tilting your head back.
Ah,
So by placing the needles there, you are directly stimulating the exact localized muscle groups responsible for that one specific backward motion. That directly explains why that particular movement sees the most dramatic measurable improvement in the clinical data.
form follows function. You treat the back of the neck, the movements powered by the back of the neck get better. That makes logical sense. But it makes me wonder about the treatment itself. We've been using the word acupuncture like it's just one monolithic thing. But is all acupuncture created equal? Did the researchers break down different styles or techniques?
We did, and this is arguably one of the most vital takeaways from this 2024 review. They performed subgroup analyses. Basically, they split the data up based on the specific type of acupuncture being used to see if one style outperformed the others.
What were the styles?
They broke it down into three main categories: general acupuncture, electroacupuncture, and something called motion style acupuncture treatment, or MSAT.
I feel like we are about to see some winners and losers in this data. How did those three subgroups actually perform?
Well, let's start with general acupuncture, just the standard insertion of needles. It was effective for reducing pain, but it completely failed to show any effectiveness for improving range of motion in any direction.
Just pain relief then.
Right. Then there was electroacupuncture. This is a technique where the practitioner attaches small clips to the needles and passes a mild electrical current between them to stimulate the muscles.
Okay.
Surprisingly, the meta-analysis found electroacupuncture to be completely ineffective for treating whiplash in this dataset. It didn't significantly help with the pain, and it didn't help with the mobility.
Wait, really? You would think that adding a little bit of electricity to actively stimulate the stiff muscles might boost the effect. Why would it fail?
The researchers suggest that it might come down to the nature of a whiplash injury. Whiplash involves acute trauma and heavy inflammation. Passing electrical currents through muscles that are already actively spasming and hyperinflamed from a car crash might simply be too aggressive.
It just makes them more angry.
It might irritate the tissue rather than soothe it. Yeah.
That actually makes a lot of sense. You don't want to overstimulate an already angry muscle.
Yeah.
So what about the third group? You mentioned motion-style acupuncture treatment. What exactly is that?
Motion-style acupuncture treatment, or MSIT, requires a much more active role from the patient. Instead of just lying down on a table and resting quietly while the needles are in, the practitioner inserts the needles into specific points and then actively assists the patient in moving their neck and body.
While the needles are in.
Yes, it's a combination of acupuncture and passive active movement therapy happening simultaneously. The goal is to rapidly break the vicious cycle of pain, causing muscle spasms, which in turn cause more pain.
And how did that specific active style perform in the data?
MSAT is the absolute superstar of this review. The researchers highlighted a specific 2020 randomized controlled trial by Kim and colleagues out of Korea. This study looked at 97 patients and evaluated the use of intensive MSAT administered very early within 7 days of the initial car crash.
Man.
The results were phenomenal. MSAT wasn't just highly effective for reducing the pain scores, it actually improved range of motion in all directions. Flexion, extension, and rotation all got significantly better.
That is a massive distinction for the listener. If you get into a crash, the data strongly suggests that you shouldn't just seek out any acupuncturist. You should specifically look for someone trained in motion-style acupuncture treatment, and you should try to get in there within the first week while the injury is acute.
That seems to yield the most comprehensive results for getting your total mobility back. That's precisely what the subgroup analysis points to. The active movement combined with the needling seems to be the key to unlocking the full range of motion.
So what does this all mean? Is motion-style acupuncture just a total magic bullet for whiplash? Can we throw away all the other treatments and just do this?
Not exactly. As with any rigorous scientific inquiry, we have to look at the limitations and the broader context. While the localized pain went down and the physical range of motion improved, there's a third crucial metric the researchers tracked. It is called the Neck Disability Index, or NDI.
How is the Neck Disability Index different from the visual analog scale we talked about earlier? Aren't they both just measuring how bad the neck hurts?
They measure very different things. The VAS just asks right now, how intense is your physical pain from 1 to 10? The Neck Disability Index is a broader, much more holistic questionnaire.
Like a lifestyle thing.
Yes, it measures how much your neck injury is actually ruining your day-to-day life. It asks things like, can you concentrate on your work? Can you read a book? Can you drive a car comfortably? Can you sleep through the night without waking up in agony?
I see. It measures functional disability, not just raw pain.
Correct. And when the reviewers ran the meta-analysis on the NDI scores across the various studies, they found that acupuncture did not show a statistically significant improvement.
That is such an interesting wrinkle in the data. Your raw physical pain drops, your ability to physically tilt your head backward goes up, but your overall daily functional disability score, your ability to just live your normal life, doesn't dramatically shift.
Right.
That really shows how deeply complex recovering from a traumatic injury like whiplash really is. It's not just about fixing the physical tissue. The whole life impact lingers.
If we connect this to the bigger picture, it perfectly illustrates the messy realities of scientific research. When you are combining multiple human trials from different countries, conducted by different clinics, in different years, the data rarely lines up perfectly. In meta-analyses, scientists use a term called heterogeneity.
Heterogeneity, meaning the studies are fundamentally too different from each other to easily compare.
Exactly. It creates mathematical noise in the data. And to their credit, the researchers of this BMJ Open review were incredibly transparent about the quirks in the studies they analyzed that caused this heterogeneity.
Give me an example. What kind of quirks are we talking about that muddy the waters?
Let's look at a 2015 study from Australia by a researcher named Sterling and their team. When the reviewers ran what's called a sensitivity analysis, which is a mathematical way of testing the data by removing studies one by one to see how the overall results change, they found that the Sterling study was heavily skewing the range of motion data.
Why? What was wrong with that specific Australian study?
In that trial, the patients weren't just getting dry needling. They were also doing a full hour of high-intensity neck and scapular exercises alongside the needling.
Wait, hold on. They took people who had just been in a car crash, who had acute whiplash, and made them do an hour of high-intensity neck exercises. That sounds like a terrible idea that would completely ruin the data.
It definitely introduced a massive variable. It becomes nearly impossible to isolate the true effect of the acupuncture. Did the needles fail to improve mobility in that study? Or did an hour of intense physical exertion temporarily aggravate the traumatized muscles and mask the benefits of the acupuncture?
Wow.
That high-intensity exercise was a major source of heterogeneity in the overall meta-analysis.
Were there any other study designs that threw a wrench into the math?
Yes, there was a 2013 study out of Belgium by Taubox and colleagues. This trial was uniquely designed as a crossover, randomized controlled trial.
What does a crossover trial look like in practice?
Think of it like trying to figure out which brand of coffee keeps you awake the longest. If you drink brand A at 8 in the morning and then switch and drink brand B at noon, it's going to be really hard to tell which one is actually keeping you up by 3 in the afternoon because the first one is still in your system.
Oh, that's a great analogy.
In a clinical crossover design, the patients receive one treatment, say the control therapy, and then halfway through the study, they switch and receive the acupuncture.
Right, so the effects of the first treatment carry over into the second half of the experiment, blurring the lines of what actually worked.
Exactly. The crossover design was presumed to be the direct reason for a lower overall effect size and high heterogeneity when analyzing the pain scores. When the reviewers temporarily removed the Taubox study from their math, the heterogeneity of the overall results dropped to a moderate, much more manageable level.
It really highlights how incredibly difficult it is to design a perfect human trial. You are dealing with so many variables. But if the data is this noisy, how do we know we can trust the positive results at all? How do the researchers fix it?
By rigorously grading the potential for bias. Despite these quirks, despite the hour of exercise in Australia or the crossover coffee analogy in Belgium, the overall quality of the science is undeniably moving in the right direction. The researchers used a highly respected evaluation framework called the Cochrane-Robb-2 tool to check for the risk of bias in these trials.
What are they actually checking for when they look for bias?
They were checking the methodology. For example, they look for proper randomization and something called allocation concealment.
Allocation concealment.
It means ensuring that the doctors running the trial don't know which patient is going into which group. It prevents a biased doctor from secretly putting all the healthiest, youngest patients into the acupuncture group to artificially inflate the success rate.
Got it. It keeps everyone honest.
Precisely. And they found that out of the 8 studies, 4 of them published after 2012, showed a low risk of bias in almost all of the assessed domains. They had proper allocation concealment, proper randomization, and minimal missing data.
That's reassuring.
So the foundation of this evidence is actually quite solid, even with the inherent messiness of human biology. A meta-analysis is only as good as the trials it includes, and the recent trials on acupuncture for whiplash are proving to be rigorously designed.
Okay, so we know it reliably works for localized pain, we know it helps with cervical extension, we know motion style is the way to go, and we know the recent data is high quality. But there's one glaring question I know the listener is naturally wondering right now. We are talking about taking a person who has just been in a traumatic car crash. Their neck is incredibly tender, hyperinflamed, and spasming, and the proposed treatment is to stick thin metal needles directly into that cervical spine tissue. Is it safe?
It's a completely valid concern.
What are the actual side effects reported in this data?
Safety is a primary outcome measured in these reviews. You don't want the cure to be worse than the disease.
Yeah.
Out of the 8 studies included, 5 explicitly reported on adverse events. And the reality is highly encouraging. The adverse events were almost entirely mild and resolved on their own within a few days without any extra medical intervention.
What kind of mild things are we talking about?
The typical localized reactions you might expect from any needle-based therapy. Some slight bruising at the insertion site, occasional mild dizziness right after the session, minor hives, fatigue, and some sweating.
Nothing crazy.
Right. Interestingly, a few studies noted things like diarrhea or nausea, but the reviewers dug into that and confirmed those symptoms were caused by other concurrent interventions the patients were receiving, like pain medication, not the acupuncture itself.
Were there any severe reactions at all? Anything that required hospitalization?
Across all the data, there was only one case classified as moderate. In that highly successful 2020 Kim study regarding motion-style acupuncture, there was a single patient who experienced an unknown bout of severe itching, medically termed pruritus.
Just really bad itching.
It was significant enough that it required the administration of antihistamines via injection, cream, and oral routes to calm the reaction down. But again, that was an isolated moderate case out of hundreds of patients.
Severe itching is certainly annoying, and requiring a shot of antihistamine isn't fun, but we really need to compare that to the alternative standard treatments for whiplash. I mean, usually patients are prescribed heavy, potentially addictive prescription painkillers, or they get nerve blocks injected deeply and directly into the spinal articular processes, or heavy steroid treatments.
Exactly. The alternatives are intense.
Compared to the potential gastrointestinal side effects, the drowsiness, and the severe addiction risks of heavy pharmaceuticals, a little bit of bruising or a single case of severe itching seems incredibly, incredibly safe.
The safety profile is undeniably favorable. When you weigh the very low risk of a mild adverse event against the proven dual benefit of pain reduction and mobility improvement, it presents a very compelling option for patients.
All right, we have covered a massive amount of scientific ground today, from the physics of a car crash to the mathematical noise of crossover trials. Let's wrap up the core takeaways for you, the listener. If you are ever unlucky enough to get into a fender bender and wake up with the stiff, painful reality of whiplash-associated disorder, you now know what the absolute latest data says. Thanks to this massive 2024 meta-analysis from BMJ Open, we can definitively say that acupuncture is a scientifically validated tool.
Absolutely.
Specifically, you want to ask for a motion-style acupuncture treatment where they actively help you move your neck, and you want to do it within the first week. It is proven to significantly reduce your physical pain, and it will help you look up and extend your neck again sanely, with very minimal, mild side effects.
This raises an important question to leave you with. We started this deep dive by pointing out that major official clinical guidelines currently do not recommend acupuncture for whiplash, simply because they were waiting for this exact kind of robust, synthesized data to be published.
Right.
Now that we finally have it, how long will it take for official policy to actually catch up to the science? And it makes you wonder if an ancient practice like acupuncture can finally be mathematically validated for a modern problem like car crash whiplash. How many other traditional therapies are currently sitting in our medical blind spots? How many other effective, safe treatments are out there simply waiting for our clinical guidelines to gather enough data to catch up to the reality of patient relief?
That is a brilliant and provocative point to leave off on. The absence of evidence is not the evidence of absence. Keep questioning the medical consensus, keep looking deeply at the data for yourself, and never stop seeking out the best, safest ways to heal. Thank you so much for joining us on this deep dive. Stay curious, stay safe out on the roads, and we will catch you on the next one.